Good morning. I want to welcome you all to the Inova Heart and Vascular Institute. My name's Heather Russell, and I'm the Vice President of Inova Heart and Vascular Institute, and it's my pleasure to celebrate Valve Awareness Day with all of you. Before we get the program started, I just wanted to mention that we do have a few seats up here by the podium, and we also have seats around the atrium if you'd like to take the elevators up, and we also have TV screens to watch the program if you'd like to sit. To get our program kicked off, it is my pleasure to introduce Dr. Chris O'Connor. He is a world-renowned heart failure cardiologist and also the editor-in-chief of the JACC Heart Failure Journal with the American College of Cardiology. He has been with us for about 3 years now, and he came to us from 31 years at Duke. He's well known for the research that he does around heart failure, both nationally and internationally, and we are honored to have him as part of our team. Dr. O'Connor?
Well, welcome. What a beautiful occasion, and thank you all for being here and really celebrating Heart Valve Disease Awareness Day. And it's fitting because this is February is Heart Awareness Month, and just a couple weeks ago was Heart Failure Awareness Week. And so we've done a lot to really help recognize everyone how important heart disease is and what we can do to make our patients and our friends and colleagues better who are suffering with heart disease. Let me tell you a little bit about the Inova Heart and Vascular Institute. It's very exciting. You're sitting in sort of the flagship of the Heart and Vascular Institute here. But really, we span across all of Northern Virginia through our 5 hospitals and 30 outpatient ambulatory centers. And we see over 72,000 people a year with diagnostic tests, evaluations, and providing care. So it's a really a dynamic, integrated program. We have outreach programs that go through 5 states. We have national programs, and we have international programs. So the Heart and Vascular Institute is really recognized as one of the top institutes in the country. But what makes this a really important vascular institute isn't the structure you're sitting in here, it's the people. And what we really advocate is a team approach to care. And you're going to hear more about that over the next couple minutes. But the structural heart disease program really accomplishes that team approach. And I think that's so exciting about how we care for our patients today. We're here really because structural heart disease affects over 1 million people in the United States, and many of the patients don't even know they have structural heart disease. 500,000 people have important aortic valve disease that's unrecognized or not treated. I got a call just last week from my cousin, and she said, Aunt Dorothy is feeling short of breath. And I said, well, let's make sure she gets an echo. And she got an echo. She's 94 years old and doing pretty well. And the echo showed severe aortic stenosis that nobody really had recognized. So she's planning to get a aortic valve TAVR procedure in the upcoming week. So it affects everybody. It affected my family just like that. We're honored really to have partnered with the Alliance for Aging Research in organizing today's national kickoff event to present this visibility and the importance of this. There's so much good news to share about heart valve disease because we have so many treatments now. We can do so much better. So really this is a celebration of possibilities, the possibilities of doing more and doing more for people. You're going to hear shortly from Dr. Eric Zarin, who's our co-director of our structural heart disease program, and Arnald Gabriel, who is someone who has benefited from the very excellent team care that we provide. I also want to recognize Sue Peschin from the Alliance for Aging Research and recognizing today's sponsors and special guests. So let's give Sue a round of applause. We also have Penny Gross from the Fairfax County Board of Supervisors, who serves on the Inova Board of Trustees, and very important work. Penny, good to see you. We're working together on some important initiatives that we can't say anything about. Pat Harity, also from the Fairfax County Board of Supervisors. Let's give a round of thank you. It's really through the support of people like this that makes all this possible. You know, Fairfax started as really and it's still committed to the community, patients first, a team-oriented care, and giving the very best. What we're trying to do is bring innovative work, exciting work that can help our patients to even a greater degree. And I think our structural heart disease program is a great example of that work. So I want to, again, thank you. Thank you for joining in this celebration. And I want to thank Heather Russell, who's my great partner, administrative partner. When things go well, I take the credit. When they go wrong, I have her take the credit. So Heather, why don't you come on up here and we'll get some of the videos going. Thank you.
Thank you, Dr. O'Connor. Next, I would like to turn your attention to the video screens. We're going to watch a short PSA on valvular disease.
As many as 5 million Americans are affected by heart valve disease, including 1 in 8 adults over the age of 75. There's a good chance that heart valve disease affects someone you know. Heart valve disease happens when one or more of the heart's valves stop working properly. If you've had a previous heart condition or are over the age of 65, you can be at a higher risk for valve disease. While some types of valve disease are not serious, others can lead to major complications, including death. The good news is that when detected, valve disease can usually be successfully treated in patients of all ages. While valve disease is common, a recent survey found that 3 out of 4 adults know little to nothing about valve disease. So remember to get your heart listened to regularly by a medical professional and visit valvediseaseday.org to find out more about the symptoms and risk factors. Now is the time to spread the word to raise awareness. Join us at valvediseaseday.org and be sure to always listen to your heart. What
a great video, and what a great way for our public to know about valve disease. So next I want to introduce Sue Peschin. She is the president and CEO of the Alliance for Aging Research. For more than 30 years, the Alliance has closed gaps in medical research and regulatory frameworks and in the clinical care that excludes older adults and fails to recognize geriatric-related differences. The Alliance accomplishes its mission through both public policy and health education. Their goal is to always move the ball forward and to work with their partners in doing so. Sue?
Hi, everybody. Thank you, Heather. It's been a pleasure working with you and your colleagues at Inova Heart and Vascular Institute on this awesome event. And you are a very good-looking group of people, so it's great to see all of you today. Thank you for coming out. We're honored to partner with more than 40 national provider and patient advocacy organizations, as well as leading cardiac centers such as Inova, on this incredible effort. And several national organization representatives are here with us today. I want to thank everybody for their partnership. Together we established this day, and together we're marking a nationwide movement to raise awareness of a disease that has not received the attention it demands. Considering that heart valve disease affects at least 5 million Americans, public awareness of the condition is shockingly low. A 2016 survey from the Alliance found that 3 out of 4 adults know little to nothing about heart valve disease. Our National Heart Valve Disease Awareness Day campaign grew out of this survey work. The good news is that while heart valve disease can be serious, innovative treatment saves lives and enables most patients to enjoy significant improvements in their quality of life. So in this case, education and awareness have the potential to make a tremendous difference. Our campaign has 4 key messages. Know your risk factors, know the symptoms, listen to your heart and get it checked, and help spread the word. We welcome individuals to join our campaign along with organizations. So if you'd like to get our e-newsletter and get engaged, please sign up at valvediseaseday.org. Please also take a picture on your smartphone today using our selfie sign, and I'm happy to pass this along when I come down. And we want you to share these on your Facebook page, or if you have Twitter. I know a lot of folks here probably have Facebook, and your grandkids would probably love to see a picture of you with this. And please use the hashtag ValveDiseaseDay. We're also co-hosting a Twitter chat with the American Heart Association and Everyday Health at 1 p.m. today. So you can check that out on Twitter at ValveDiseaseDay and also the hashtag ValveDiseaseDay. We're also going to be ringing the closing bell at the New York Stock Exchange later this afternoon, and you can follow that on Facebook on the National Heart Valve Disease Awareness Day Facebook page. That'll be a few minutes before 4 p.m., and there'll be a live feed of that. The work that we do in heart valve disease would not be possible without the generous support of the Edwards Life Sciences Foundation and Medtronic. So I want to thank both of them for their commitment to this effort, and please join me in thanking them. I also want to recognize, we're going to be expecting the Honorable Barbara Comstock in a little bit, but I also want to recognize the office of Congressman Gary Connolly. We have Alex Robbins from his office here, and we have Maggie Herman from Senator Warner's office here today as well. I'm going to pass things back to Heather, and then we'll continue with the program. Thank you, everybody.
Thank you, Sue. Next, I want to introduce one of our co-medical directors of our structural heart disease, Dr. Eric Zarin. He is a great example of the talent that Dr. O'Connor has brought to IHVI over the last 3 years. He leads our program and is making a significant difference in our patients' lives. Eric?
Good morning. It's nice to see so many people here today, especially some former patients. It's always very heartening to see people coming back to visit us. We love that. My name is Eric Zarin. I'm one of the cardiac surgeons here at Inova. On behalf of all the cardiac surgeons, particularly our Chief of Cardiac Surgery, Alan Spear, who couldn't be here today, we're thrilled to be a part of this event. In addition, I want to recognize my co-director for structural heart and valve disease, Dr. Matthew Sherwood, who heads it up from the interventional cardiology side. I think applause are absolutely appropriate. We also have, I know Kelly Epps is here, or she's in the back as well. I just put her on the spot, but also an active part of our program. And then to my right here, nothing happens without our team here of nurses, nurse practitioners, nurses, administrators. So these are the people that really make the engine run in terms of what we're trying to do to advance our treatment for structural heart and valve disease. So I'm thrilled as a physician who spends the vast majority of my time dealing with valvular heart disease. I'm thrilled to be a part of this event and to hopefully raise awareness, because I really do think that we're on the cusp of this, becoming a really important part of our treatment of valve disease in the United States. It's going to become an increasingly it'll become a public health problem. I have some slides. I don't know if we can get those pulled up, and I realize it's going to make you look away from the podium, but I'm okay with that. So some of this is actually, I've taken a couple of the graphics that were available online from the Alliance for Aging Research, specifically from their Valve Disease Day, which I think is a great reference if you're just looking for a place to start out. But the important part really is, the take-homes are you have 5 million people currently in the United States that we believe are living with heart valve disease. 1 in 8 people age 75 or older are dealing with moderate or severe valve disease, and about 22,000 people dying a year in the United States related to valvular heart disease. What I think is particularly telling, and I may need help advancing this, if you can give me the next slide. What's particularly telling is some survey data that they released as part of their as a part of this day to raise awareness, is that of these patients who got a new diagnosis of heart valve disease, 2/3 of them had no familiarity with heart valve disease whatsoever, and 60% of them were found to have heart valve disease while they were getting a checkup for some other reason. And that really belies the sort of insidious nature of valve disease, and we're going to talk about that a little bit, that it really can lie beneath the surface for quite a while. you give me the next slide, please? Okay, so just by way of background and review, there are 4 valves in the human heart. Broadly speaking, when we talk about dysfunction of a heart valve, we're talking about valves being either too tight or stenotic, meaning they don't open well when the heart beats, or being too loose or regurgitant, they leak, meaning they don't close well. And within those 2 broad categories, we're typically defining valve disease as either being mild, moderate, or severe. For those of us that deal mostly with adult patients, we're really typically focused on the left side of the heart, particularly the aortic and the mitral valve. Now I got the clicker working. Okay. So part of the problem, the reason this is becoming more of an apparent problem in the United States is that we've done such a good job of managing other health problems. So in the last 50 years, our life expectancies in the United States as well as around the Western world has increased dramatically. And what that means is more and more folks now are making it into their 70s, 80s, and 90s because we've managed to treat a lot of the other health problems along the way. If you look at some current census data, it's projected that in the United States by the year 2050, we expect to have at least 25 million folks 80 or older alive in the United States. So and therein lies the problem, because we know valve disease, degenerative valve disease, increases with age. And if you look at the graphic there, you'll see, and this is consistent across multiple studies, that inflection point typically starts to go up when you get into the 6th decade of life. So something that it's typically not affecting you when you're a younger person. Clearly, certainly in other parts of the world, rheumatic heart disease is more of a problem, but not so much here. But when you get into your 60s, 70s, and beyond, valve disease starts to become more and more apparent. And as we said before, the initial symptoms can be very easy to dismiss. It's shortness of breath, it's fatigue, feel like you're getting a little bit more tired. And quite frequently, it's only with the benefit of hindsight, after getting treated, that patients will say, you know what, I didn't realize how limited I really was. I just thought this was part of getting older. So just specifically to focus on aortic valve disease, if you look at this, the graphic that's up on the screen right now is probably one of the most reproduced graphics in all of cardiovascular medicine. Came from a landmark paper that was published 50 years ago. But it really delineated and crystallized the pathophysiology of aortic stenosis. So we know that people with a tightening aortic valve can get along for a while. They'll have a long latent period. But then once they reach a critical point, start to become symptomatic, they can decline very quickly from a clinical standpoint, which is really what this is all about. We want to identify people during that latent period, make sure they get appropriately treated, screened, and referred for therapy. And again, as I said, it's not a fluke. In multiple studies, population-based studies around the world consistently find the same thing, that valvular heart disease starts to increase dramatically as we get into our 6th, 7th decades of life and beyond. The prevalence of severe aortic stenosis, looking at some recent studies in the United States, I'm going to back up one slide, but usually at about the age of, in the mid-70s, about 1% to 2% of the population has severe aortic stenosis. That increases to almost 6% by the mid-80s. And there's some smaller data that smaller studies that suggest that increases even more as you get into the 9th decade of life as well. Mitral valve regurgitation is something that we also recognize as being a problem as people get older. Many people will carry a diagnosis of mitral valve prolapse or regurgitation for many years, and it's often striking that I'll see somebody who has symptoms, with clear symptoms of valvular heart disease and even congestive heart failure, and when you start asking them about their history, I have mitral valve regurgitation, but I've had that for years. So clearly there's a gap in terms of education of making people understand that these things will progress over time, and just because it's as a part of your history, it's something that needs to be observed and watched to make sure it's not progressing. Mitral valve regurgitation, again, follows a similar pattern to aortic stenosis in the sense that once you get in your 60s, 70s, and beyond, it's going to start to increase. So the good news, the upshot of all of this, is that valve disease is treatable, okay? And we know that from decades of work with open heart surgery, okay? Whether it's with a traditional median sternotomy incision, whether it's through a minimally invasive approach, heart valve disease as treatable, patients can expect outstanding outcomes. And again, as I said, we know from years and years of work that if somebody gets referred in a timely fashion, gets the appropriate treatment, they go back to living a very full life with really no limitations, and we can put them right back up on that life expectancy as if they had never had that problem. Okay? What's particularly exciting, though, is all the new technology that's come into this field. And in the last 10 years, the explosion of options to treat valvular heart disease, I think, it's unparalleled, certainly across a contemporaneous time period with anything else in medicine. And I think in the history of medicine, there are not many things that would rival it. What's been particularly exciting for us in the Structural Heart and Valve Clinic has been the introduction of transcatheter aortic valve replacement. And I'm probably going to need one click to help play that other video. But basically, what we know now from very large, well-designed clinical trials is that we can, for patients that are at an increased risk for open heart surgery, and therein lies the rub, right? We're talking about these valve problems becoming more apparent as people get into their 70s, 80s, and beyond. But oftentimes, people who have lived that long often start to develop other health problems. So they're going to have other comorbid medical conditions, other risk factors that might make their ability to survive an open heart operation it's going to be a little bit more challenging. What these studies have shown for us with transcatheter aortic valve replacement is we can achieve comparable results in terms of the outcome without having to put someone through an open heart operation. So without the sternotomy, without being on the heart-lung machine, without that long extended time in recovery. And it's really revolutionized the way we can treat patients, because not only are we treating patients that we probably wouldn't have even offered surgery to before, we're giving patients that would have been at an increased risk for surgery a better option. And don't take my word for it, because I can see a few of our patients here today, and they all look fantastic. What this has also done is really changed the way we practice medicine. And Dr. O'Connor talked about this in his remarks, but the way we view valvular heart disease now here at Inova is the model for the way everyone is doing it around the world. And it's really what we call the heart team concept. So instead of just having one practitioner, one physician, one provider who kind of sees you and makes all the decisions, you're going to be seen by a team of people, and that's going to be a cardiac surgeon. It's going to be an interventional cardiologist, an echocardiographer. We have a radiologist, heart failure specialist, obviously our phenomenal nursing team. And it's that group, that team of people that's then going to put their heads together, and you're going to get the benefit of all of them bringing their expertise to the fore and really coming up with what the best possible solution for you is. And if you need any sort of reminder or emphasis about how important it is, you don't have to look any further than just over your left shoulder, because that's where our valve clinic is housed. So it's really front and center, something that is going to be a pillar of, not just here at Inova, but for cardiovascular disease in medicine going forward. It's going to be a pillar for any major program. A couple of the clinical trials that we're involved in, I think, are particularly exciting, and that's one of the nice parts about being at a big institution like this with just a phenomenal track record in cardiovascular medicine, is it gives us the opportunity to offer new technology to patients as part of very well-controlled and managed clinical trials. We're currently the only site in the DC metropolitan area participating in the Partner 3 trial. That's a trial that allows us to now extend transcatheter aortic valve replacement to patients who are at a lower risk for surgery. So basically allows us to to offer transcatheter valve replacement for any patient, regardless of their risk strata. We also just recently began enrolling in a transcatheter mitral valve replacement therapy. So mitral valve therapy is you probably, in terms of the transcatheter approaches, it's a little bit behind in terms of aortic valve therapy, but I think the field is equally, if not more exciting, because we really feel like in the realm of mitral regurgitation, there's a huge unmet need, potentially even greater than aortic stenosis, because a lot of patients are just out there not knowing that there are options there for treatment. So 2 trials that we're really excited about, and my co-director, Matt Sherwood, he's the one who really heads up all of the clinical trials in our structural heart division. All right. I guess that means my time is up. But I think, look, the take-homes for the talk, if nothing else, are, and I think, listening to your heart is by far the most important thing. But I think it's important that everyone understands that valve disease is a real problem. It's out there, and you may not necessarily know it, but, having an awareness, ask your physician about it, and be screened for it. But the real take-home for you to take home and to share with your friends and family is that we've never ever had more options to effectively treat heart valve disease, and we're eager and just itching to help anyone and everyone who needs it. Thank you very much.
Thank you, Eric. Now it is my pleasure to introduce you to retired Colonel Arnald Gabriel, a World War II veteran who at 91 underwent a minimally invasive transcatheter aortic valve replacement. He is a fine example of the amazing results that can be achieved in treating heart valve disease and restoring people to a full and vigorous lifestyle. Colonel?
Thank you very much. It's a pleasure to be here. And thanks to the doctors and nurses at Inova here, it's a pleasure to be anywhere. Just a little bit about my history, because it really impacts on my valve replacement. As was pointed out, I'm a World War II veteran, and most of my life I was a musician, but during World War II, I was a .30 caliber light machine gunner with over 200 days in combat from D-Day to the Elbe River. And I also felt that I had so many comrades who died by my side that I kind of owed them something, that I wanted to make something of my life. And in high school, I was a musician, so I went to college after World War II and got my degrees, master's and bachelor's degree. In 1951, I joined the United States Air Force as a band director and spent 34 more years as a band director, the last 21 of which was here in Washington, D.C., with the Air Force Band, singing sergeants, airmen of note, and strolling strings. And I mentioned that because during all of that time as a conductor, I played all 50 of the United States and 50 countries of the world. And I also guest conducted in most of those places, and I wanted to continue that. I'm 92 and be 93 in May, and continue to do about 20 guest conducting jobs a year. In the summer of 2016, I became extremely exhausted, went to my cardiologist, and he said, you have aortic stenosis. I had no idea what that was, and he explained it. You have calcium in that valve, which inhibits the blood from going to the rest of your body, which makes you fatigued. And so he said I should come here to Inova. And of course I was extremely reluctant because I wanted to continue my career. I have 3 contracts to conduct when I'm 100, and I want to make that. As a matter of fact, next year I'll be conducting the 75th anniversary of D-Day. And having been a veteran of D-Day, I want to make that one for sure. I did the 70th anniversary, which was the first time I had been back. So in August of 2016, when I came here, I was about to do a job in Pearl Harbor, the 75th anniversary of Pearl Harbor. So I told Ellen Boyd, my nurse, I said, you got to make me well. I've got to go to Pearl Harbor in December. And sure enough, she kind of held my hand and encouraged me to take that surgery. I was extremely reluctant. I said, what happens if they replace a valve in the heart and put another one in? What happens to the heart in the meantime? I thought, well, my heart's going to stop beating. Well, the doctors and nurses reassured me there was nothing to worry about. Their track record was fantastic. And they were all extremely supportive. And as I mentioned, I did make the 75th anniversary of Pearl Harbor, and I think we have a clip. Can we show that? This is the USS Missouri. As you know, World War II treaty was signed on the Missouri. And there were 1,500 high school students from the United States and Japan. And if I look a little stressed, that's what you look like when you conduct 1,500 high school students. played America the Beautiful, which I thought was appropriate. Oh, there's more. In addition to the 1,500 musicians, we had a 100-voice chorus. Now, obviously, I couldn't have done that had I not had a aortic valve replacement. But in any event, I just feel... Well, there's a line, the final line in the movie Saving Private Ryan, where Private Ryan is standing before the grave of Captain Miller, who saved his life. And he turned to his wife and he said, "Did I lead a good life?" And that's been my mantra all the way. I think I owe something to the comrades that gave their life in World War II. So I want to continue until I'm 100. And thanks to the doctors and nurses here, and especially Ellen Boyd, a special nod to her, I love you, who encouraged me and held my hand, extremely reluctant. But I'm living proof that aortic valve replacement saved my life. And if you have any reluctance or anybody in your family has reluctance, please tell them this is the place to come. 100% success. Thank you all very much.
Thank you, Colonel. You did a great job, and you definitely are the reason why we all come to work every day. It's seeing the outcome of what our surgeries do, to have a fulfilled life and to have events booked till you're 100. I just can't believe it. That's awesome. We have a little bit of a slight delay. Comstock is on her way, and she will probably be here in the next 3 to 4 minutes, Elizabeth. I can't see you because the lights are bright. Is that her? Oh, no, okay. So I'm going to just hold off for a minute in her introduction for her arrival. She'll be here in less than 5 minutes. I apologize for the delay.
Please don't go away. Is this how it's supposed to be? I'm running out of ways to make you see.
When we talk about structural heart and valve disease, what we're really talking about are the internal structures of the heart. Dysfunctions related to the valves or any walls separating the chambers of the heart. Historically, these were things that were always managed with open heart surgery. When we talk about structural heart and valve disease, what we're really talking about are the internal structures of the heart. Dysfunctions related to the valves or any walls separating the chambers of the heart. Historically, these were things that were always managed with open heart surgery, but we've had an explosion of technology in the last 5 to 10 years. It's very exciting and allows us to treat these patients just as effectively, but with a much more minimal approach in terms of trauma to the body and their physiology.
So at the start of our program, the Inova Heart and Vascular Institute built a hybrid cardiovascular operating room that allows specialists such as interventional cardiologists and cardiothoracic surgeons to work together to bring new special therapies for structural heart disease patients. We can offer patients transcatheter aortic valve replacement, transcatheter mitral valve repair and replacement, and new technology with transcatheter tricuspid valve repair. We also offer patients with atrial fibrillation, left atrial appendage closure with the Watchman device. That reduces the risk of stroke without the need for adjunctive medications. We can also offer closure of atrial septal defects and ventricular septal defects for our patients who have adult congenital heart disease.
When we started in patients who were at high risk for aortic valve surgery. Those patients underwent transcatheter aortic valve replacement, which is basically a non-surgical method of replacing the aortic valve.
We're able to take the aortic valve and now mitral valve and replace them without the standard large incisions entailing the heart-lung machine. The patients can be treated with less invasion and with less interruption of their normal lives.
Initially, there was a lot of skepticism that TAVR was ever at any point going to be an equivalent therapy to surgical AVR. I think it's becoming clearer as midterm data is released from partners. So the two therapies in a select population are more or less equivalent, and certainly in higher, even intermediate risk patients, that relative equivalency ends up greatly favoring TAVR because of the shorter recovery, lower morbidity, lower mortality. Extrapolating that data.
Okay, we're going to go on with our program. It is now my pleasure to introduce Honorable Barbara Comstock. In November 2016, Representative Comstock was reelected to her second term to represent Virginia's 10th congressional district. This was her sixth electoral victory in 8 years, including her career in the Virginia House of Delegates, where she served from 2010 to 2015. A resident of McLean, Virginia for more than 30 years, Representative Comstock first served as a senior aide in the 1990s to the Virginia Congressman Frank Wolf, who represented the 10th Congressional District for 34 years. As a senior aide to Congressman Wolf, she was immersed in issues to Northern Virginia, such as federal employee and health care issues, telework and business issues, and appropriations for the district. In 2013, Representative Comstock funded the Young Women's Leadership Program for young women in high school and middle school. The program is designed to inspire the next generation of young women by bringing them together with women leaders in a variety of careers and professions throughout the region. She brought this mentoring program to Capitol Hill, and more than 800 young women have participated in it. As Congresswoman, Representative Comstock worked to pass the 21st Century Cures legislation, which overhauled the development of medical treatments and cures for patients at the FDA and NIH, as well as early detection, better treatment, and factors cures for chronic diseases such as cancer, diabetes, and Alzheimer's and heart disease. She stood up strongly to fight for those with pre-existing health conditions and fought against efforts to reinstate lifetime caps in healthcare coverage. She supported the Clay Hunt Suicide Prevention for American Veterans Act, which requires veteran administrators to make mental health information easily accessible for our returning veterans, helps the VA recruit and retain psychiatrists, and requires an annual and independent review of mental health care and suicide prevention programs. She has worked with federal, state, and local officials on the Regional Heroin Operations Team and the Shenandoah Valley Opioid Task Force, and is also a member of the Bipartisan Task Force to combat the heroin epidemic in the U.S. House of Representatives. The House passed Congresswoman Comstock's amendment to increase funding for the High-Intensity Drug Trafficking Areas program that helps coordinate local, state, and federal law enforcement authority drug interdiction efforts. And she has supported the Bipartisan Comprehensive Addiction and Recovery Act. Please join me in welcoming Congresswoman Comstock.
Good morning, and it's wonderful to be here and celebrate with you and to hear all the success stories here. And I'm so honored to be joined here with my friend Pat Harity, who I know is also one of your great success stories here, which we are very grateful for all his contributions to our community. This is such a great institution. At least 5 million Americans have heart valve disease, and yet 3 out of 4 Americans know little to nothing about the disease. So this Awareness Day, I really appreciate all that you're doing here in the community and providing this information. I'm happy to be here with the Alliance for Aging and all of the partner organizations that came together to make this day happen. I really salute the excellent healthcare professionals at Inova Heart and Vascular Institute in Fairfax. In particular, thanks to Dr. Christopher O'Connor and Dr. Eric Zarin for their impressive leadership. And bravo to retired Colonel Arnald Gabriel for his service and for his willingness to share his inspirational story as a heart valve patient. Thank you again. So can't wait to hear about all of the things that you're going to continue to do. And please tell us all your other secrets of looking so great and being so vibrant. This state-of-the-art flagship location on Inova Fairfax Medical Campus is one of the most complete, technologically advanced medical and research centers in the U.S. In 2016 alone, it had nearly 35,000 patient visits and treated patients from 48 states and 8 territories or foreign countries. As was mentioned, I've been so happy to work on so many pieces of legislation that help and impact here. This year, we are working to make sure that in the budget that we just passed, that we get more money to NIH for research, because we know we are on the cusp of great breakthroughs. And it's because of institutions like this that we're going to be able to take the money that we are now spending in the government and leverage it and see great things in our lifetime. Because we're an aging population in this region. I have my parents, fortunately, doing very well. I'm not going to tell my mom's age, but my dad's turning 84 next Monday. And he is a heart patient. He had his first heart incident in his 30s. And he is now turning 84 next week. So consider what that means for the healthcare in his lifetime and how that's changed. And what we're going to be able to do to change our quality of life because of everything that is going on here. So I am so thrilled to be here today and to honor all of you. You know, we like to say Virginia is for lovers, with a picture of the big heart right in the middle of it. Well, Virginians and Inova really have a great big heart here. And we need to listen to your heart, make sure we're doing everything. Should mention one of the bills that I got to pass back when I was in the State House was the pulse oximetry bill that is a test that's done on little babies when they're born now. And so when my 5 grandchildren were born, now they get that little test done. All they have to do is put a little, little test around the wrist and find out if they have a heart defect. So they find out that right when they're born. I have a friend of mine, I'm a godmother to his daughter, but his little boy, I believe is now 13 years old, was operated on in this hospital. He was born with a heart defect. And the nurses, the wonderful nurses, picked it up very quickly. And he was operated on when he was 3 days old. And then he went on to have some other complications too. He had to have open heart surgery again later on in his life. But he is now a vibrant 13-year-old, doing well, thanks to the great work of this hospital. So you can see how, like my dad at 84, this young man is going to be going strong thanks to the wonderful work that is done here. So thank all of you for being here today and celebrating this wonderful work. And God bless you all. And on this Heart Healthy Month, we will continue to get the word out. Thank you.
Thank you, Congresswoman Comstock. It's a pleasure to have you here, and we appreciate all your efforts around heart disease and valve disease. And Colonel Gabriel, you truly are inspiration to us all. Thank you very much for being here. And I want to thank the rest of you for being here. This has been a wonderful celebration. If you need a parking pass, Cheryl Battle, who is standing right over here, will issue a parking pass so you can get out of the garage. And again, anything you can do to help us promote Valve Awareness Day is much appreciated, and thanks for coming. Have a good day.